Cardiovascular evaluation with exercise testing. The items you want to take a look at are your ECG, heart rate, BP, cardiac output, O2 pulse, and stroke volume. Your very first step is going to be to compare your EKG, your heart rate, and your blood pressure to the patient's resting values. For example, with your ECG, you're looking to see if there's any changes in rhythm. Is there any evidence of ischemia or heart block? Remember, PVCs are the most common arrhythmia that occurs with exercise. In those with coronary artery disease or cardiomyopathy, arrhythmias with exercise are common, but you still need to make sure you stop exercise at appropriate times if you start to find those abnormalities. Heart rate, you're looking to see if it is increasing as it is expected, and then blood pressure, you're looking to see if the systolic is increasing and if the diastolic is remaining constant. Remember, with exercise, your systolic blood pressure should increase. It shouldn't go over 250, but it should increase, and your diastolic heart rate should remain the same. The reason your diastolic heart rate remains the same is because as you exercise, your body releases vasoactive chemicals and vasodilation should occur, so that would keep your diastolic pressure either remaining constant or you might see it drop just a little bit. Next, you're going to want to consider if the changes that you see are what you expected to happen when the patient exercised. For example, the heart rate should increase linearly with an increase in VO2, or oxygen consumption. So the first thing you want to identify is, did the patient achieve 85% or higher of the maximum heart rate? To find the maximum heart rate, you're going to take 220 minus the patient's age, and that will equal their maximum heart rate. So to find 85% of that, you take 0.85 times the max heart rate. If the patient did reach maximal or did achieve 85% of their max heart rate, then that says that they used maximal effort. So you can use heart rate as a gauge of your patient's effort. If they didn't, then the next question you're going to want to ask yourself is, what limited the test? Why didn't they get to their max heart rate? Did they say, I'm short of breath, so you stop the test? Did they complain of chest pain, so you stop the test? Did they have a sore knee, so you stop the test? Because based on that, you're going to want to correlate those two items. Next, you're going to look at your blood pressure. Again, your systolic pressure should increase, but it should not go above 250 or higher. When this occurs, it's considered exercise-induced hypertension, and of course you want to stop the exercise at that point. Remember, the increase in systolic pressure is due to an increase in cardiac output, which has a 5 times effect on the blood pressure as compared to stroke volume, which only has a 2-time effect. So when you see your systolic pressure increase, it's predominantly due to the increase in cardiac output. We're going to talk more about cardiac output later, so keep that in mind. Then again, did the diastolic blood pressure remain constant or decrease a little bit? Again, I mentioned that this is due to vasodilation, which occurs with exercise. If the diastolic pressure increases, it suggests possible coronary artery disease. This isn't confirmatory, but you might want to start thinking that that's possible. And that's meaning that the vasodilation is not efficient. It there's maybe vasoactive chemicals being released, but for some reason it's not causing the vasodilation effect. That could be because the vessels are blocked with clogged arteries, and so that's why the diastolic pressure would go up. Possibly. The next thing you're going to assess is your cardiac output based on your heart rate. So without going back through all of our cardiac physiology, I think you can recall that cardiac output is dependent upon your heart rate and your stroke volume. You actually multiply the two. Heart rate should increase from 70 to about 200 beats per minute with exercise. In contrast to that, your stroke volume will increase from 80 to 110 milliliters. So you see the stroke volume has a smaller effect on cardiac output as compared to your heart rate. So your heart rate is the dominating factor here. So this is actually going to help us understand what's going on in there. So how we use this is we look at low workloads. We should see an increase in cardiac output, and that's going to be highly dependent on both your heart rate and stroke volume. However, when you get to higher workloads, when you see that increase in cardiac output, it's going to rely on the heart rate. So if your heart rate increases abnormally high at a lower moderate workload, then you know that that is due to the heart rate, because the heart rate has the predominant effect. So what this tells you then is if they have a higher heart rate at low to moderate workouts, the heart rate is compensating for that stroke volume. So that means the stroke volume is reduced. Now this could be either due to deconditioning, or maybe the patient has some underlying heart condition. If a patient has a decreased heart rate with exercise, it doesn't get up as high as you would expect, or it doesn't move hardly at all, that would be due to your beta blockers, or the patient has had a heart transplant, so the sympathetic nervous system isn't even creating an effect on the heart, which is kind of cool. O2 pulse. This is known as the poor man's estimate of stroke volume. So O2 pulse is the volume of oxygen consumed per heartbeat. Like I said, it reflects the stroke volume. You can use the Fick's equation to calculate it out. We're not going to go there. But this is another estimate of fitness level. So I mentioned before, if a patient reaches their max heart rate, it can be a measure of the patient's effort, which if they are giving good effort and everything is linearly increasing with VO2 max, that can also suggest they have a good fitness level. So O2 pulse is another thing to look at to determine a patient's fitness level. So let's take a look at it. Normal patients who are basically healthy, we'll say, at rest will have 2.5 to 4.0 milliliters of oxygen per beat. When they start to exercise, you should see it increase to anywhere between 10 to 15 milliliters of oxygen per beat. So if a patient has a low O2 pulse, okay, but they have a high heart rate, we already said the high heart rate alone at moderate intensity tells us they have a poor stroke volume. But regardless of what intensity it is, if they're close to their max heart rate or not, if they also have a low O2 pulse, then this also tells us they have a poor stroke volume, which suggests some type of cardiac disease. It's not specific, but they probably have something going on there. As a side note, okay, so a healthy person, they're going to exercise, you're going to see their heart rate go up close to their max, you're going to see them get to their 15 milliliters of O2 beats for their O2 pulse, so you're going to see, that good stroke volume. But their heart rate is going to be somewhat lower. That same effect you'll see with someone who's on beta blockers. So someone on beta blockers will have an increased O2 pulse, but they'll have like a max heart rate which is on the lower end, and at rest a low heart rate. That sounds confusing, but keep in mind, beta blockers will cause an increased O2 pulse. So don't confuse that with someone who's fit. Okay, that's the takeaway, that last sentence right there. Okay, let's take a look at a situation. So here we have a patient, and I forgot to put this up at the top, but this patient's test was ended for shortness of breath, okay? Here are their resting values. Here are their maximum exercise values. Here's their predicted max and their percent of predicted. So when we want to evaluate this, we need to ask ourselves some questions. One, was the max heart rate reached, or 85% of it? Because when someone who reaches 85% of their max heart rate, we say they pretty much reached their max heart rate. So they're at rest, their heart rate was 91. 91 is pretty high for resting. Okay, so that leads you to think either they're deconditioned or they're not a fit individual. We'll go with that. Then calculating out their max heart rate, we see their predicted max would be 165 and their max achieved was 153. So that means their percent predicted was 93%. So if we just look at that 93% of predicted, we would say, hey, they have some good effort, right? It would 93%. But keep in mind, their heart rate was already elevated, okay? So you have to take them all into consideration and weigh them, okay? Next, number 2, did systolic blood pressure increase but remain less than 250? Well, it started at 150 over 85, so they're already hypertensive. And then they get to 225 over 105. So they are borderline exercise-induced hypertension. Okay, they're not at the 250 mark, but they're getting there. Next, did the diastolic remain constant, or, oh, that should say decrease by 10, not increase. My apologies. This should say decrease. And no, it did not. The diastolic started at 85 and went up to 105. So that increased by like 20 mmHg. This is abnormal. Vasodilation was not efficient. This should have remained constant. So it leads you to question, what makes the diastolic pressure increase? A lack of vasodilation, which highly suggests coronary artery disease. That's abnormal. Next, let's look at our O2 pulse. Our O2 pulse went from 2.9 to 5.6. Yet, it says they were at maximum effort. So O2 pulse should be anywhere from 10 to 15. Okay, so this person did not get that. So remember what that tells us. An O2 pulse that does not get up to its normal level suggests stroke volume is reduced. So here we have two things now that tell us stroke volume is reduced. The O2 pulse and the high diastolic pressure. Next, we want to take a look at why the test was ended. The test was ended for shortness of breath. Shortness of breath can be a symptom that occurs with coronary artery disease and can correlate with a reduced stroke volume. If not enough blood is pumping out to the heart, you're going to have an abnormally elevated heart rate, which may make your patient look like they gave good effort, but then when you take it into combination with their elevated resting heart rate and their O2 pulse, which did not increase as it should, when you look at all of this, you have to start thinking their shortness of breath is possibly due to coronary artery disease. We know the stroke volume is decreased. We have some support for that. And then shortness of breath is why the test was ended. So this would be the most logical conclusion when we're only looking at the cardiac evaluation.